Good morning and thank you very much for joining us. I am Yori Folani. We'll stay on health today following the announcement yesterday by NPHCDA, the National Policy on Health. Well, you know how it is. They made an announcement yesterday that going forward, they're going to be integrating childhood immunization with COVID immunization. And then while they were at it, they gave us some figures. For instance, we learned from yesterday that a total of 14 million odd eligible persons have so far received the first dose of COVID-19 as the first dose. And they also tell us that around 5 million odd eligible Nigerians have been fully vaccinated. This is as of yesterday. Okay, now to find out a bit more about, and they say that now they're going to be, combining, as it were, both the, childhood immunization and indeed the anti-COVID immunization. We'll be speaking this morning with Dr. Basi Okposan-Basi. He's a director, disease control and immunization, and Julie Mogbo, who is a public health nurse in the private sector. But before we come to, well, maybe I could just say good morning to our guests. Both of them are online, so good morning to you both. Thank you very much for making the time to join us. Just before we, meet with you and begin to speak with you, let's take this. Oh, there you are. Good morning, Dr. Basi, and good morning, Ms. Mogbo. Thank you very much for making the time to join us.
Good morning.
Indeed. Thank you, sir.
Good morning.
Thank you, ma'am. So we'll take a background report now, and then we'll come straight back to you. Please stay with us.
The 14th press briefing actually.
This is the first meeting with the agency for this year. A little over 5 million eligible Nigerians have received their first and second jabs. Part of this progress report has revealed that Nigeria has so far received more than 60 million doses of vaccines. The agency begins with an update on the inclusion of childhood vaccination for children within the age range of 0 to 23 months at COVID-19 vaccination sites.
Alongside the COVID-19 vaccines, childhood vaccines will also be available at the COVID-19 vaccination sites. Consequently, parents and guardians with children aged 0 to 23 months are urged to take them along to the vaccination sites.
In 2021, just over 40 million were received, and so far in 2022, 21.9 million vaccines have been received and given to Nigeria.
Although the number of vaccinated is not evenly distributed across states, some have been highlighted for their outstanding progress in the vaccination process. Others have also been urged to revitalize efforts, with leadership playing a key role in mobilization.
Our deep dive into the state's performances revealed that Nasarawa, Jigawa, the Federal Capital Territory, Ogun and Kwara states have remained the top 5 performing states on COVID-19 vaccine uptake.
The challenge now is to ensure that we remain at a minimum of 200,000 a day, but increase that to 300,000 a day so that we can meet our target during the course of 2022.
There was an increase of cases over the holidays as many variants sprung up, affecting mainly the unvaccinated population. The agency affirms that it has increased access to ensure that more Nigerians get their jabs.
Okay then, so that's, the background report. And now to our guests. Once more, to introduce them, Julie Mogbo. She's a public health nurse and family health consultant. And we also have with us Dr. Basi Basi, Director, Disease Control and Immunization at the National Primary Healthcare Development Agencies. Now, let me start with you, if I may, Dr. Basi. Following the press conference you had yesterday, before we get into quite a number of interesting angles to it, I was a bit surprised when you spoke about your deep dive in your research and the fact that you just talked about 5 states that are really leading, as it were, in the uptake of this. I was a bit surprised that Lagos wasn't one of them.
Okay, I think you want to thank all the states with their opening questions why Lagos is not one. We want to thank all the states for all the efforts that are currently ongoing in the vaccination program. Before I narrow down to the Lagos, as you have mentioned, it interests us to know that as at this morning, about 19.97 million doses of the vaccines have been administered. If we go down into both details, about 14,234,000 Nigerians have received their first dose so far. And then for the second dose, about 5,279,000. And then for the booster, about 428. Lagos is a part of the states that have contributed to these figures.
Okay.
But looking at these figures, and we have the need as a team at the strategy group that is ably chaired by the Executive Director of the agency, Dr. Faisal, where we look at the data on a daily basis, and we share this data with all the states. So the 5 you mentioned are the 5 states that in the past 2 weeks have topped the chart amongst the states.
Okay.
Lagos, we want to commend the governor of Lagos and the entire team for the work they are doing. But all the states have targets that they were given, and they are also reaching out to vaccinate their indigents. But for now, at the top 5, they are not among the 5, but they are doing excellently well, reaching out to Nigerians. Almost 1.7 million Nigerians reach in Lagos State alone for now. So we commend the state for the work they are doing.
Indeed. Well, as you said, we all states need to be commended. In terms of our attitude, our national attitude, that is the public attitude, that is the ordinary man in the street, the challenge from our end here, speaking with people, is the uptake that you were talking about. It hasn't been all that professionals would want. There are the skeptics, there are the naysayers, but perhaps those figures are still encouraging that you let us know as to those that have indeed come forward. But it seems that, because I noticed the way it's phrased is that out of the eligible people, that's where you bring the figure from. So there are many more people than those who actually took the vaccine, and I wonder how worrying that is, Dr. Bassi.
Yeah, you are very right when you say there are still many more that are yet to be reached. Now we are targeting reaching about 117 million eligible Nigerians. And as I mentioned, for the first dose, we have just reached about 14,234,000. Many more are still yet to be reached, like you said. Now, talking with people and having discussions, one of the key things we find out is the fact that, the rumors that were around before the vaccine came into the country, like when people were saying, if you take the vaccine, you're going to run mad. If you take the vaccine, you have to collapse and die. If you take the vaccine, when people started taking the vaccine, they graduated to saying, no, once you take the vaccine, you start, your body starts magneting, a lot of things happen, 2 years, you're going to die. But I just want to tell Nigerians, all these are false. They are false. This happened when we started the polio campaign in Nigeria, where at the point of almost achieving eradication, these rumors came up that the children would die, they would be infertile after taking the vaccine. A lot of things went on. Today we have our children. We have eradicated polio as a country. Some of those children that took the vaccine now have their own children, and their own children, some of them are marrying now. That rumor, nobody remembers about it again. It was all rumors, and that affected the program.
Okay.
Now they said, and for Nigerians, people said when we take the vaccine, we'll run mad, we'll die. We have administered 19.97 doses as at this morning in the first, second dose, and the booster. None has run mad in the course of taking the vaccine. None has also died directly attributed to the vaccine. I don't know what else we want to tell Nigerians. I will just add this point. Let's remind Nigerians, India, we are at the stage where we are. The vaccine was there. They refused to receive. They were sending their vaccine Covishield to us to take at the early stage of the vaccination. Until the Delta variant struck India, you recall what happened in India. People were just following. They were losing over 200,000 persons were dying on a daily basis. Over 2 million cases were reported. The only thing India could do to bring down this pandemic impact was going back to take the vaccine. Over a period of 6 weeks, they were able to administer 1 billion persons, and that controlled the pandemic. Now, we also have heard about the Omicron variant that has come up. There are some countries, as we are talking about lockdown. We don't know which of the variants that will come to Nigeria that will show the Indians what Delta has shown, will show the people in Greece and Brazil what the Omicron is currently doing. We need to stay safe. We need to be protected. We need to take the vaccines.
Indeed.
So I want to tell those who are slow in responding, please don't listen to people, because the vaccines that are available are very safe. Recently, one of the things I've heard people in the course of discussion, even the allies saying they will not take the vaccine, is the fact that they are saying, if the vaccine is safe, why is it that we take a first dose, we take a second dose, the person still comes down with the disease? I had a discussion with one of my physician consultant friends recently, and I asked him a question. You have children, 3, say yes. You have given the measles vaccine, he said yes. I said, let's use the measles vaccine experience that you know very well to explain. As a doctor, do you believe measles vaccine is effective? He said yes. I said, okay. Deep diving into the measles vaccine, if you give 100 children the first dose of measles vaccine, 85 of these 100 will develop a lifetime immunity against measles. You give them a second dose after 6 months, additional 10 that had partial immunity will now develop full immunity. You now have 95 over 100. And then you give them opportunity for a booster. The first booster, now additional 3, you have 98 over 100. The difference is that child that took the vaccine among the 15 that did not develop full immunity, taking the first dose, if that child comes in contact with measles, maybe at school, in the church, playground, the disease will be less severe.
Okay.
The rashes will be less. The fever will be last just 2-3 days. The baby will be playing around, eating. But a child who never took the vaccine, if he faces or contacts the measles disease, of course your guess is as good as mine what the parents will pass through. And we end up losing some of those children, and some of them come down with permanent disability. Now, the same thing with COVID-19 vaccines, currently when you take. If you take it, statistics so far have shown that about 62 to 67% of persons after taking the first dose, they are protected against symptomatic infection. In other words, because they are humans, they still live in the environment that have the virus. They are exposed to the virus. Of course, they will contact it, but they will remain asymptomatic because they have been protected. Now, if they take a second dose, we now have about 82 to 89% of these persons also can become asymptomatic. You see, there's another pool of people now with the second dose, they have graduated to being asymptomatic, even they come in contact with the infection. And then if you take a booster, it gives about 92 to 96%. So you can see the similarity with the measles. So with the first, the second, and then the third, we have the immune defense system being stimulated, and you have more people being protected. And even if they come in contact with the virus, because they must, because if they are not observing protocols of washing their hands frequently, using their face mask or face shield, and other protocols, observing social distancing, they are exposed to the virus. So they can inhale it, contact it, come down with it. But the only thing you will see with them is they will be tested positive because they have the virus in them. But they will not show symptoms of the disease.
Okay.
Neither will they have severity of the disease to be hospitalized.
Okay.
And we can see to confirm this, the fact that if you check the NCDC website today, you will see that of the number of persons that have died in Nigeria from the virus, as of today, 3,126 have died from the COVID. This would have been prevented. 91% of these persons that have died never took the vaccine.
Okay. Okay, doctor.
The remaining 9% are among those who have yet to complete their doses and have some other comorbid conditions that they died. So you will see that for those who have taken the vaccine, the hospitalization, their hospitalization rate is reduced. Most of them, they are asymptomatic, and nothing will happen to them. And yet you still see people will not believe because it has not come some of them not very close to them, and there's no strain that has come into Nigeria yet that is as devastating as Delta was for the Indians. I want to plead with Nigerians, please don't listen to those rumors.
Okay. All right.
COVID-19 is real. The vaccines are available, effective, and very safe. Don't listen to what people are saying.
Okay.
This one that we have a solution to, let's embrace it.
All right. I'm going to come back to you, Doctor. I'm going to come back to you, Doctor. Thank you very much for setting the scene there. Julie Mogbo, you're a public health nurse and family health consultant. The point that Dr. Bassi was making there about the usefulness of the vaccines, you still might get it, but the symptoms are a lot lighter and a lot more manageable. You probably are aware too that, our people, there was the doctor pleading. So our people are a bit, lackadaisical in terms of the uptake. I wanted to ask, what's your experience in the care of people who do come down? Because we've just come out of the holidays, and that was something of a super spreader event, perhaps. Did you notice the difference between those that came down that had been fully vaccinated, because we heard incidents of that, and how difficult, how much more challenging is the job of caring for patients that might have come down with it, whether you've been vaccinated or not? What's your experience? Could you share some of it with us, please?
Okay, thank you very much. Yes, caring for patients who have come down with the COVID-19 disease has not been easy, because the first thing is, when people hear about the condition, the first thoughts that come to the mind is that they're possibly going to die. That's one. Then how well will the treatment be, the quality of care in the facility they're to go to? It's something that they do not have full trust in. So these are some of the things that play out when we are managing patients that have come down with COVID-19. It's been difficult for the adults due to some of the reasons that I have said. We have people not adhering. We have relatives who love their loved ones that are ill and would still want to come in even though there are restrictions. We've had cases where we have lost a patient due to COVID-19, and we have visitors coming in to see other patients, and we're asking them kindly wait, because we have to manage their expectations, we have to manage their emotions. They need to understand, okay, so what's going on? You don't just go tell relatives that, oh, someone just died of COVID. It's going to cause a pandemonium. So managing that has been difficult. We're doing our best in clinical settings. We're doing our best when we have opportunities to talk with relatives, we talk to families. But when it comes to managing children, how well have the adults accepted the treatment protocol, the preventive protocol? If we have more adherence, if we have a compliant attitude, then managing the children will be less difficult. Having them bring their children to take the vaccine won't be as much as a problem. But we have a lot coming ahead of us, and we just have to prepare for it, because there are going to be doubts. We're going to have questions. People are still in doubt if this even exists. to start with. We're still struggling to get adults to put on their masks, to wash their hands, to maintain physical distance, to stop visiting or spending more or longer time in the hospitals. These are the challenges that we're still dealing with, and more would come from what I foresee.
Okay, indeed. Thank you. I'll be back to you. Dr. Bassi, she was speaking about children there, and that sort of brings me on to the other, shall we call it an initiative, that NPHCDA is now going to integrate childhood vaccines with COVID vaccines. That is to say, the venue at which you can get them. You can, wherever you can get the COVID vaccine, if you're a mother of an infant, as you medical people call it, 0 to 23 months, you'll be able to take care of business there as well as a parent. Tell me about that. Tell me about that, because I sort of studied the release, and it's not saying that children can get the vaccine, but they can get their own special types of vaccines at the venues that adults can get COVID. Am I right so far, Doctor?
Okay. You know, like the Executive Director, Dr. Faisal mentioned yesterday during the press briefing, we are in the third phase of the vaccination now. We had the phase 1, we had the phase 2, we are in phase 3 now. In the first and the second phase, were more of the COVID-19 vaccination. Now, when we look at the trend of vaccination, early 2020, when this pandemic was announced in Nigeria, as at that time, our smart survey was showing that the country had achieved 70% on routine immunization. In the course of the year that 2020 over the 2021, there has been a little drop in the routine immunization, and with the intervention instituted by the agency, it has started peaking, and the vaccination is ongoing. We have seen that, like any other services, both the childhood vaccination is also affected in the course of the COVID. Now, this time around, there are also investment from the federal government, our partners and donors, to ensure that these COVID-19 vaccines are administered to eligible adults. So what the Executive Director and the management and our partners have decided to do this time around, since they are health workers, other personnel that have been trained, supported to deliver the COVID-19 vaccines to the adults, let's provide additional layer of support that our children are also vaccinated. We are encouraging Nigerians who have children less than 23 months that are yet to be fully vaccinated, as they are going for their own vaccination, not just to go alone, but go along with these children.
Okay.
As they go, our health workers have been trained, they will screen the children, they know the vaccines that the children are yet to receive, and they'll be able to administer those vaccines to those children. Instead of just going as an adult on their own, let's use that opportunity, use resources that are available, and also ensure that our children are vaccinated.
Okay.
At the end of the year, we want to see both the coverage for COVID-19 vaccine and routine immunization being high. We want to see the COVID-19 transmission being achieved in Nigeria, and our children being prevented from these vaccine-preventable diseases. So that is the entire the package that the agency and partners have for Nigerians.
Okay.
Administering the COVID-19 vaccine to the adults, and their children are also being given routine immunization as they are due. So please, Nigerians, take your children. As you go for your vaccination, take your children along so that they can also be vaccinated.
Okay, then. Could you both please stay with us, Julie and Dr. Bassi? We'll take a break now, but we'll be right back. Okay, welcome back, and we're looking at the the latest update that we got from the National Primary Healthcare Development Agency, and we're speaking with Dr. Bassi O. Bassi, Director of Disease Control and Immunization, as well as Julie Mogbo, Family Health Consultant. Now, Julie, to you, the idea that I don't know if it's an innovation, but the new idea, the idea we have now that mother and child can go. The mother can fix herself as far as vaccinations that concern her, and at the same time, if your child is, less than 23 months, wherever the child is in that junction, the professionals there will know what is lacking and can handle it. Combining both together like that, it's okay because, I don't know, are kids immune? 0 to 23 kids immune from COVID-19? So why bringing them in there as a nurse? What are your thoughts on that? I'm just talking as an entire layman, I'm an entire layman, but having a 23-month-old baby or younger in an environment like that, what are your thoughts?
All right, I would like to remind us that that same age group have a routine of vaccines that they take that guide them against childhood preventable diseases. Some are tetanus, polio, tuberculosis, whooping cough, and others. So it's a regular thing for a baby to be taken to the primary health care center to be vaccinated against childhood preventable illnesses. So this isn't out of place. But because we're talking about COVID-19 and it's a pandemic, we are expecting to have the reluctance, the hesitance, and with parents and mothers. There are lots of questions they're going to be asking. So we shouldn't just expect that just as they bring in their children for the polio vaccine or the vaccine against tuberculosis, they're just going to open up their hands or rush to these centers. That should not be expected. So it's going to be quite challenging. There has to be a lot of orientation done. For the babies, they are not immune in a sense, because report has it that it is possible that children under the age of 1 could be at risk of contracting COVID-19. And the possible reason is that the immune system is quite immature. The immune system is quite immature and they have smaller airways. So this makes them susceptible to having respiratory challenges. Because also they may not have maybe an adverse reaction in a sense, that is because already children are susceptible to cold. So they have vaccines that kind of protect them against pneumonia. So studies are ongoing. So far, it's been said that it's okay. If we look at the US, they have approved certain vaccines for children already. And so far, I have not heard about any adverse reaction on the part of the babies. So just as one would take a child to go have routine immunizations taken, it's just the same way. I think it's the responsibility still of mothers and other caregivers, those that are probably taking these babies, to ensure that they wear their mask, they have their hands clean. Then the institutions have their own responsibility as well. Let there be normal physical spacing or distancing. Professionals there, the healthcare workers, they have their mask on, and necessary preventative protocols are put in place, and they will just be fine. I am only very particular about the orientation of the people. So it's important that the agency, every stakeholder is called on board, religious leaders, traditional leaders, local government chairpersons, everyone should find a way to answer the questions that these families will be asking. Once people understand the procedure, their fears are allayed, then we'll have them respond better to this immunization or the vaccination.
Okay, then. So, Dr. Bassi, now that we're talking about the young people, the sort of the addition that we got in the brief, talking about Dr. Bassi now. What is the age? What is the age? I'm directing this to Dr. Bassi. What is the age where people become eligible for vaccines, for anti-COVID vaccines in Nigeria. Just to refresh our mind on that. Well, I can't see Dr. Bassi's picture. Maybe there's a technical problem with Dr. Bassi, so we still have your picture there, even though I was directing my question to Dr. Bassi. I don't know, maybe the studio can help me out and tell me if we have Dr. Bassi or not. Yeah, Dr. Bassi. So I was going to ask, since we're talking about young people now, what is the age at which every young person in Nigeria, is it 18, is it 21?
Okay. Now, for the age for vaccination in Nigeria, for now, is 18 years and above.
Okay.
Everyone 18 years and above is eligible for the COVID-19 vaccination. There have been concerns, questions from people why younger age groups are not included. As of today, for the age group 16 to 18 and lower, they contribute to only about 2.57% of the positive cases. And so with the guidelines that are available at the policy for now, the vaccine is for 18 years and above. Every adult 18 years and above is eligible for it.
Okay.
The agency is keeping tab of the trend and analyzing the disease burden, the age group involved, and when there is a need for it to be lowered, that will also be done. And so that is the direct answer to the age group. And please, we want to beg all Nigerians 18 years and above, please go out, take your jab, and stay safe.
Indeed.
Over.
Okay. Well, I think I should just thank you very much, Dr. Bassi Oposen Bassi, Director, Disease Control and Immunization at the NPHCDA. You certainly have helped us a lot understand our responsibility, you know, in this pandemic, what we ourselves can do, take ourselves over there, get the vaccines that we need, get all of them, and also behave in line with the sort of guidelines that we've always had. You might probably be disappointed, especially if you look around in Lagos, where I am at and where we're broadcasting from. It seems that things have relaxed. You don't see the same seriousness with which people were using masks before, with which people were, you know, just generally taking extra care. It must be said, in my experience, that is to say, what I have seen, people think that COVID has receded, is not as much of a danger as it used to be, and I'm saying that coming from the behavior, the public behavior that we see. Many more people are not wearing masks than those that are wearing. In fact, you have the almost ridiculous situation where people are being made fun of for insisting on wearing a mask. That can't be to the pleasure of the agency, I know, but it is what we're living with.
Okay. You know, on this, what I want to advise Nigerians, please, let's not expose ourselves and face the kind of situation, as I mentioned earlier, we experienced or we read from India. On a daily basis, there are different variants of these vaccines coming in, and that usually happens when a community, a nation has not achieved herd immunity. Once there is no attainment of herd immunity, the possibility of mutations very common, and we cannot stop transmission. You will see the disease, if it comes in, it will cause havoc. Now, Delta variants, we experience it also in Nigeria. Most of the cases recorded were Delta. But when the experience in India was not the same with the Delta variant and some other countries where the mortality was very high. Now we have the Omicron variant. There are some countries that are on lockdown because of the severity of it. Like you rightly said, some will see it and say, oh, the disease is not very severe, after all, people are moving around and so on. Do we know the variant that will come next that may be very devastating to our nation? The best, if we don't have an answer to that question, is for us to be protected and safe, so that no matter the variant, it will not affect us.
Okay.
Once a nation achieves herd immunity of 70%, they can stop transmission of the virus, and they can also stop the tendency of mutations.
But we're nowhere near that yet.
To attain that in Nigeria.
But we're nowhere near.
Yes, we are not near that yet.
Okay.
And I would like to use this illustration to demonstrate to Nigerians what we are doing if we allow it to go that way. If I want to come to Lagos from Abuja now, where you are, I have options. I can decide to trek from here to Lagos. Somebody trekked during the 2015 election. I can come with a bike, maybe power bike or anything. I can come with a bus, a car, and I can decide to come with a flight. I think I'll be very wise, and I would like myself if I come with a flight, because I can even come to Lagos and return the same day. I can come, I will be very happy with myself. It's doing myself good than saying I want to come with bike.
Okay.
I had mentioned earlier, if we want to stop transmission of the virus, stop mutations, not allowing any variant come in and mess us up as a country, the best way to go about this is to attain herd immunity. The flight that can take us to herd immunity, as I've just mentioned, is vaccination. If we are all vaccinated, we come out, we receive our jab, attain 70% in the next 1 month, 2 months, we will be able to stop transmission of the virus in our nation.
Okay. Well,
if we don't listen to rumors and come out slowly the way it's happening, it might take us over 10 years when other nations would have stopped the transmission.
Okay.
Please, Nigerians, let's come on board on this flight.
Thank you very much.
Let's take our vaccination and know that for the COVID-19 disease, we have attained it and achieve our herd immunity and stop the transmission on our land.
Thank you very much, Dr. Bassi Okposen Bassi, Director of Disease Control and Immunization at the National Primary Healthcare Development Agency. Thank you, Doctor, for making time for us this morning. Okay, then. So we expect you to call in case you wanted to add your experience to that and also your thoughts on the matter. We still have on Zoom Julie Mogbo, family health consultant, and we were talking about we're a far way away from a herd immunity simply because, as you heard there and as you know, there still are a lot of skeptics out there. But we do have the vaccines in, but the uptake is apparently what the question is. Okay, the uptake is what the question appears to be. Ibrahim has called in from Kaduna. Good morning, Ibrahim.
Good morning, sir. Good morning for your two girls.
Indeed.
Okay,
we've been left by Dr. Bassi.
Right, it has been a while now. This topic, I just tuned in and I got quite interested in it. And listening to them, keenly interested to the topic is very nice because people like me have taken my own figures. Remain needed to me after 6 months. Now, my concern mostly now is that all these things is fully ravaging surrounding the urban area. This our issue of urbanization concerning this vaccine or whatever that is a national matter is always involved in the urban area. Please, some of us or most of us that come from village like myself, because that is my concern. I always fight for that champion. You see, what about the issue? What is the concern concerning the people in the village? Are they not part of the country of this nation? Are they not part of the society? Are they not human beings as well? Do they have some challenges in that aspect? So my question to your guest is this: what are they going to do so that this also gets down to the root? And finally, my advice is this: it's okay. Our government has leaders communicating, but we as a society as well as and some of us, please, Mr. Yomi, I said this last time that when we spoke, I said, look, let us not forget about our roots. Nobody that says I don't have a village. But does not mean that we are not going to make the concern. Yes, the most popular concern of us is that let us always try to treat matter start from the grassroots, so that the villagers, the type of challenge they are facing, so that we're able to eradicate from there. What we eradicate from the urban now, what about the downstream? It's not going there. Please, my concern is advise to this man, let them try and make sure that anything that concerns a national issue will go down to the grassroots as well, so that he's able to eliminate all this, eradicate this disease, all this and that. Once and for all, thank you once again for their updating. I appreciate it. Bye. Thank you.
Indeed. Thank you very much for calling in, Ibrahim. And we do want to hear from anybody else who wishes to add anything by way of their experience or their concern or their suggestion to it. And NPHCDA is watching or listening to this. And so they will know that these are concerns that still need to be addressed. Julie, as the doctor was explaining, the variants, they keep on mutating. He explained how that is. If you don't have herd immunity yet, you know, there's plenty of space for the vaccine to proliferate. In fact, I was reading that even the Omicron has what you people refer to, people in the field refer to as, what is it now? A sub-variant. They say there's now even actually, it's suspected that there's a sub-variant, but let's not concern ourselves with those, you know, technical matters yet. But it's all just explaining to us how very virile, if that is the word to use, this vaccine is. And that seems to suggest that everything that we can do for ourselves, we need to be doing, contrary to what appears to be, you know, the case on the streets, at public parties, church services, mosques. Everybody has virtually gone back to the way we used to be. And so and we don't want to shut down. Nobody wants to shut down. And it would appear if you listen to news around the world, take the UK for instance. UK recently announced that it will not be requiring school children to wear masks anymore. It will, even working from home is no longer required. All of these begin to give indications that perhaps it's not as bad as it used to be. Would that be a wrong way to, a wrong mindset to have?
Okay, so if I got that correctly, we're currently having challenges. There's a decline in compliance with preventative protocols. We have people not bothering about putting on their mask anymore. So if you're still faithful, if you still adhere, you sometimes find out you're the only one putting on a mask in an environment. So we're having currently that to deal with that challenge. I am very concerned about continuity. Something that is lacking, is a huge gap. So when something happens, you see Nigeria get up, everyone is running, everybody's talking about it, you're advocating, advocates spring up overnight. But after a while, it seems everybody goes back to sleep. We don't want to start recording increased number of deaths. We don't want to threaten people to do what is necessarily expected, what is normally expected of people to do. Without COVID-19, I've said this before, and without COVID-19, it's unhygienic to discharge to have any respiratory discharge without properly covering up. So whether you're coughing, you're sneezing, it's not professional, it's not healthy to just cough in the open. These are the things we teach before COVID-19. Then understanding the severity of these, we really shouldn't push people. I think the challenge we're having is personal governance, is self-regulation, where people are not taking responsibility to ensure that they are safe and those around them are safe. So I also said this the last time I was on air, if you think an individual thinks that they don't need to wear a mask, you don't know how healthy your neighbor is. You have no idea what premorbid state that person is. So for the sake of your neighbor, wear your mask. And you don't even know how many of us take our health seriously, how many of us go for comprehensive health checkup, how many of us know the state of our health currently. If we had a positive health-seeking behavior, then the indices of chronic illnesses will not be high, because it's actually high at the moment. So we need to have us take more personal responsibility in adhering to the prevention of COVID-19. Let's wear our mask. And if we start using the carrot and stick method, Nigerians are going to start complaining all over again. And like you said, we cannot afford. A lockdown is very expensive at the moment. We cannot even consider it. So I think a lot of work should still be done. There should be continuous meetings of leaders, of advocates, of influencers. Let's use different means to reach out to the people. We have the information on the news, we have on
Julie,
social media, but there are some population that do not have the information.
Thank you
so we
very
should
much,
be
Julie.
able to find means to reach to everyone.
Indeed, thank you very much, Julie. Really appreciate your making time for us this morning, coming on and giving us the benefit of your advice and your professional experience. And for our part, this is what we always do: try to put it out there, whatever, especially as it relates to, the COVID-19, pandemic. Whatever we can do, we will be doing on TVC and especially on our program as well. There you have it. The news is that now, as parents go for their vaccination, the mothers especially, you can also take care of the kids up to 23 months, as well, once and for all. So that's our program today. Please join us tomorrow for a fresh edition. I am Yori Folarin. Bye-bye for now.